Hello, everyone. Well, welcome to part Gamma Alpha to be exact, of Reflexology history. We will be examining the text of the Medicina of Aurelius Cornelius Celsus. Just a quick refreshment. In part Alpha, we saw that statements implying that the Chinese practiced reflexology from ancient times are not referenced and do not appear to have an evidence base to provide backup for their validity. In part beta, we examined the Egyptian hieroglyphic. We unfortunately saw that Egyptian academic cycles do not agree with reflexologists that this is a form of foot massage being practiced or reflexology. They believe it's a foot operation. Just a quick note that if it was a foot operation, the practitioner working on the feet, I think, would not have his back turned to the patient or the place being operated. Another suggestion here I would like to make is, I find it interesting that both recipients have their hands in their armpits, in the axilla. And I remember that in Dr. Paul Nozier's book, he is the founder of ear acupuncture, and he embedded the fetus in the ear, and this is the map we reflexologists commonly use. And I remember reading in his book that while he was working on the ears, he would palpate the radial artery, and changes in the pulse of the artery would guide him in his treatment. So I would like, just as a suggestion, to say that maybe the Egyptians were doing something similar, and the recipients were palpating the artery, one of the arteries in the axilla. So, asking, was anything similar regarding foot reflexology documented in ancient Greece? We'll need some help. I will ask from, as did Homeros, in the two books, Odyssea and Iliada. In the beginning, he asks assistance from the muses. I choose Clio. She is the scholar, the researcher. She is the one who ignites the desire to record. She is the muse of history. And Clio tells me to look at the period of history that is called Roman Greece. This period begins in 146 when the Roman Empire conquered Greece and lasted to around 330 AD. And what happened during this time? Well, it seems that all Greek physicians were enslaved and sent to Rome in order to serve the elite citizens of the Roman Empire there. And at this period of time, Cornelius Celsus, he was an encyclopedist, not a physician. He compiled vast knowledge, Greek knowledge, into encyclopedias. Unfortunately, and fortunately, the only one that exists is the Medicina, the 8 books of medicine. And it is interesting to notice that in this encyclopedia, Celsus references 80 Greek medical writers, physicians. And this is, I think, of great importance in order to prove that the Greeks influenced the medicine in this time. So going to the original text, in the beginning, we read an introduction of Celsus, and he speaks about Asclepiades and continues on to Hippocrates as the founder of massage in general. And I would like just to say a few words about Asclepiades. Asclepiades was the first physician to visit Rome, and he established Greek medicine in Rome. And he was from Bithynia. He is surprisingly unknown, though he was the first physician who created a health and disease theory which has similarities to what is known today as molecular medicine. His motto was treat the patient swiftly, harmlessly, and pleasantly. I think it should remind us here about the Egyptian hieroglyphic. What is of interest of Asclepiades is that according to Pliny the Elder, and also we can read in Sir William Osler's book, The Evolution of Modern Medicine, a story about Asclepiades. The story goes that in a passing funeral procession, Asclepiades noticed that the dead person was not really deceased, and he revived him to the amazement of everybody around. There is an unreferenced part to this story, and I'm looking for this part to prove it or to not prove it. And it is supposedly Asclepiades rubbed his feet, and this is the way he brought this man back to life. Getting back to the text, Celsus speaks about rubbing. He means massage. Massage is from the word maso. It's Arabian, and its roots are from the East. And so Hippocrates would use the word rubbing more extensively. And he writes, sometimes rubbing should be applied to all over the body, sometimes to a part only. Why? Either because weakness of the limb actually demands it, let's say it's paralyzed or something like that, or that of some other part of the body. This implies the concept of reflexology as we know it today, but also the method that we use traditionally, which is Bingham described it as cross reflexes and referral areas. Continuing on this point, I would just like to add that the Chinese, through the meridian theories, have proved that we can treat one side of the body by affecting the other. This is shown on the large intestine meridian, which is the meridian that crosses over. But I would like you to notice that Hippocrates also had a meridian. He had 4 pairs of veins. These are considered meridians. You can find more information about this on my blog. And on the picture on the right, you see that the 3rd pair of veins, and this one also crosses over, implying that you can treat one side of the body by affecting the other. In this slide, you can see all 4 pairs of meridians of Hippocrates, and if you're into meridians, I would suggest you visit my blog and find the thesis that was prepared by my teacher, Mr. Tilikides, and read more about it. It's very interesting. Please join me on part Gamma Beta. I had to break this down. See you in Gamma Beta, where we will continue discussing about the Medicina.